My sciatic is killing me, doc. I hear that all the time. But let me tell you, it's possible that it's not coming from your spine. It might be coming from the piriformis muscle right here. This muscle starts on the front of your sacrum right here. It cruises out and it goes to something called the greater trochanter of the femur over here. And here it is, the famous piriformis muscle. So this muscle it has a close neighbor, and that close neighbor is your sciatic nerve. So it can actually get flared up. It can have adhesions from microtraumas. It can get overly contracted because the glutes aren't firing.
I just started getting the sharp pain in my hip that felt like a needle was going from my hip to my spine every step. And in my work, I put in 20 to 30,000 steps a day. My glute muscles are not strong enough to support what I was doing, and the piriformis muscle was taking over and wasn't happy about it.
You can have an internal rotation of the femur, and that can cause trauma to this muscle, and it can get inflamed and then push the sciatic nerve. It can also, you can have emotional situations where you get trigger points in the piriformis muscle. It's crazy. Piriformis syndrome will trick you occasionally, but I have an incredible solution. I'm Dr. Adam Fields. I'm a chiropractor, and I work with the Piezowave to put low energy, focused shockwaves into the piriformis muscle. So let me show you how we do this, right? We have this shockwave therapy that goes at a prescribed depth, and so we can modulate it how deep we want it. When we want to get on that tendon over there, what we do is we go a little more shallow, and we go right into the tendon. If there's calcification in that tendon, it'll literally go in there, send the sound waves in it, and break up the adhesions. Then if it's overly contracted or if there's myofascial trigger points, we can go into the belly and bring blood to the area, and literally there's MRI studies showing before and after the trigger points dissipate, the muscle relaxes. It actually brings new blood. It's called angiogenesis into the area. Phenomenal. If there's a trauma, what happens, and this is kind of mind-boggling because you read study after study showing regeneration of tissue, regeneration of tissue, regeneration of tissue with this machine, and you're like, okay, I believe it. And so it can actually help regenerate the tissue, the sheath around the muscle, into the muscle fibers, into the tendon.
I went to my doctor and we took some x-rays. Nothing was wrong with the hip. Nothing was wrong with the spine. Went to physical therapy, and I was trying to do the exercises the physical therapist was telling me to do, but I was not having any success until I found the chiropractor office with Adam Fields and the team here. And the Piezowave treatment, I noticed the difference the first time and went home, and the pain was starting to go away.
There's one interesting study here where comparing radial extracorporeal shockwave therapy and corticosteroid injection in the treatment of Piriformis syndrome. The fascinating thing is they found just the same results with the corticosteroids and the shockwave. However, if we have an injured muscle, why would I want to put a corticosteroid? Cortisol in your body is released when there's a lion in the room and your body goes, oh, I might die, I might be without a fuel source. And so what it does is it releases cortisol to convert your tissues into glucose. So you have extra glucose in your body, and that feeds your brain in case there's a horrible situation going on. So the cortisone will actually break the tissue down, whereas this machine will actually help regenerate tissue. The tissue becomes better than it was before. So I love helping the Piriformis syndrome. Another titled Surgical and Non-Surgical Treatment Options for Piriformis Syndrome, a literature review. Here the authors recommend this technology before even thinking about surgery.
Geez, today I'm walking straighter, I'm putting on my clothes without pain, I'm able to start looking at jogging again and running again, something I haven't been able to do for 2 or 3 years.
So let's go with a more natural approach. Let's just put sound waves into your Piriformis syndrome. We do it with people all the time. Pair that with a good rehabilitation protocol, and boy, we're helping people like you.